ASCO 2015 coverage on Oncology.TV. Thomas Baldrick along with Dr. Greg Nowakowski from the Mayo Clinic in Rochester. Thank you, sir, for coming by.
Thank you for having me over.
Let's talk about this robust study that you have ongoing right now, and if you would, first provide an overview.
Absolutely. So for over 15 years now, we know that there are two subtypes of diffuse large B-cell lymphoma. The ABC subtype, or activated B-cell-like, which is associated with inferior outcome, and GCB, or germinal center-like, which typically associated with better prognosis. Until recently, we were unable to do anything about this, but now we have a number of agents which are specifically active in ABC subtype of diffuse large B-cell lymphoma. Those agents are now being introduced to upfront therapy. And one of those agents is lenalidomide. In fact, we had done a study at Mayo Clinic which showed that if you combine lenalidomide with standard therapy in diffuse large B-cell lymphoma called R-CHOP, and this combination we call it R2-CHOP, this combination appears to be improving the outcome of patients with ABC subtype of diffuse large B-cell lymphoma, which is the subtype, again, typically associated with poor outcome. This and other studies led by our Italian colleagues had resulted in development of this international trial called the Robust trial, or DLC-002, which is a global study run in multiple countries, which is looking at the comparison of R2-CHOP, so lenalidomide R-CHOP versus R-CHOP alone in patients with newly diagnosed diffuse large B-cell lymphoma with ABC subtype of diffuse large B-cell lymphoma. What's really unique about this study, this is using a state-of-the-art marker. So we used gene expression profiling to identify patients with ABC subtype of diffuse large B-cell lymphoma. And this is done in real time. So patients who are approached about entering the study will be typed by this assay, and we'll let them know if they indeed qualify for the study. And the study is open only for patients with ABC subtype of diffuse large B-cell lymphoma, which is the subtype which can benefit the most from this combination, we believe. Studies are actively open in US and multiple centers around the world, and the recruitment to the study was initiated. The target accrual goal for this study is over 500 patients to be randomized into two-arm, lenalidomide plus R-CHOP or R-CHOP plus placebo.
So you know at this point in time you have a robust design. What have you presented in terms of data or results here at this ASCO conference?
So this is one of the trial in progress abstracts. So we're just showing the study design and what assay we are using to identify the patients which may actually benefit from entering the study. Previously, at the last ASCO, we had presented our data from Mayo Phase 2 study, which showed that addition of lenalidomide to R-CHOP appears to be improving significantly the outcome of patients with ABC DLBCL.
In your view, what is the impact of doing this study? I know you don't know where it's going to wind up, but what is the impact of doing it and the importance of doing it?
So, we all talk about precision medicine and how precision medicine is changing how we treat patients. And this is one of the examples how the precision medicine is now directing therapy. What's important about this study is that we're able to match the best possible treatment to patients with a particular molecular subtype of diffuse large B-cell lymphoma.
Very good, doctor. Thank you. We wish you the best.
Well, thank you.
Appreciate your time.
Thank you for your time.